Stop wondering and start understanding. The human body is a complex and fascinating system, and one of its most crucial components is the lymphatic system. This system plays a vital role in maintaining our health and fighting off infections. But what happens when something goes wrong, and how does this relate to cancer? Let's dive deeper into the world of lymph nodes and cancer to uncover the answers. How exactly does cancer spread to your lymph nodes? To understand this, we need to first grasp the basics of the lymphatic system and its functions. The lymphatic system is a network of tissues and organs that help rid the body of toxins, waste, and other unwanted materials. Its primary function is to transport lymph, a fluid containing infection-fighting white blood cells, throughout the body. The lymph system, part of your immune system, includes lymph vessels and nodes. Lymph vessels are similar to veins and capillaries, but instead of carrying blood, they carry lymph fluid. This fluid circulates through the body, collecting waste products, bacteria, and other harmful substances. The lymphatic system also includes lymph nodes, which are small, bean-shaped structures that act as filters for harmful substances. Think of lymph vessels like veins, but instead of blood, they carry lymph, a clear fluid loaded with infection-fighting white blood cells. These white blood cells, also known as lymphocytes, are crucial for our immune response. They help identify and destroy foreign invaders such as bacteria, viruses, and even cancer cells. The lymph fluid travels through the lymph vessels and eventually drains into the bloodstream, ensuring that our body remains clean and healthy. Lymph nodes, those small filters scattered throughout your body, trap and destroy germs, including cancer cells. They are strategically located in various parts of the body, such as the neck, armpits, and groin, to effectively filter the lymph fluid. When the lymph fluid passes through these nodes, harmful substances are trapped and destroyed by the lymphocytes. This process helps prevent infections and keeps our body functioning optimally. But what happens when cancer outsmarts these defenses? Cancer is a disease characterized by the uncontrolled growth and spread of abnormal cells. These cells can invade and destroy healthy tissues, including the lymphatic system. When cancer cells manage to evade the immune system, they can spread to other parts of the body, including the lymph nodes. This process is known as metastasis, and it is a critical factor in determining the severity and treatment of cancer. Cancer can start in the lymph nodes or spread there from other parts of the body. When cancer originates in the lymph nodes, it is referred to as lymphoma. However, more commonly, cancer spreads to the lymph nodes from a primary tumor located elsewhere in the body. This spread occurs when cancer cells break away from the primary tumor and travel through the lymphatic system or the bloodstream to reach the lymph nodes. When it spreads, cancer cells break away from the primary tumor and travel through the lymph system. These cells can then lodge in the lymph nodes, where they may continue to grow and form new tumors. The presence of cancer cells in the lymph nodes is a significant indicator of the cancer's ability to spread and is used to determine the stage of the disease. The staging of cancer is crucial for developing an effective treatment plan and predicting the patient's prognosis. Most of these cells are destroyed, but sometimes a few survive, settle in a new spot, and form new tumors, a process called metastasis. Metastasis is a complex process that involves multiple steps, including the detachment of cancer cells from the primary tumor, their survival in the circulatory system, and their ability to invade and grow in new tissues. Understanding this process is essential for developing targeted therapies to prevent and treat metastatic cancer. Doctors use biopsies to check lymph nodes for cancer. A biopsy involves removing a small sample of tissue from the lymph node, which is then examined under a microscope to detect the presence of cancer cells. This procedure helps determine whether the cancer has spread to the lymph nodes and provides valuable information about the type and stage of cancer. Biopsies are a critical tool in the diagnosis and management of cancer. If found, it helps determine the cancer stage and the best treatment options. Knowledge is power. By understanding the extent of cancer spread, doctors can develop a personalized treatment plan that may include surgery, radiation therapy, chemotherapy, immunotherapy, or a combination of these approaches. Early detection and accurate staging are key to improving the chances of successful treatment and long-term survival. Stay informed, stay strong. Facing a cancer diagnosis can be overwhelming, but staying informed about your condition and treatment options can empower you to make the best decisions for your health. Support from healthcare professionals, family and friends is also crucial in navigating this challenging journey. Remember, you are not alone, and there are resources available to help you every step of the way. Download this info as a PDF for more details. For more comprehensive information about lymph nodes, cancer, and treatment options, consider downloading our detailed guide. This resource provides in-depth explanations, helpful tips, and answers to common questions. Staying informed is the first step towards taking control of your health and well-being.